Alright, let's dive into the first topic we'll be discussing today. Understanding the causes and risk factors of psoriasis. As you may already know, psoriasis is a chronic skin condition that accelerates the life cycle of skin cells. This results in the formation of red, scaly patches on the skin surface. But what exactly causes psoriasis? Well, it's a combination of genetic predisposition, environmental triggers, and the involvement of the immune system. First, let's talk about the genetic aspect. Research has shown that psoriasis has a strong genetic component, meaning that if you have a family member with psoriasis, you are more likely to develop the condition yourself. In fact, it's estimated that up to 10% of the population may have a genetic predisposition to psoriasis. However, not everyone with this predisposition will develop the condition. This is where environmental triggers come into play. Environmental triggers are external factors that can initiate or worsen psoriasis symptoms. Some common triggers include stress, skin injuries such as cuts or sunburns, infections, and certain medications. It's important to note that triggers can vary from person to person, and what may worsen psoriasis for one individual might not have the same effect on someone else. Now let's talk about the role of the immune system in the development of psoriasis. Normally, our immune system helps protect us from infections and other harmful substances. However, in people with psoriasis, the immune system becomes overactive and mistakenly targets healthy skin cells. This leads to the production of excess skin cells, causing the characteristic red, scaly patches. In summary, psoriasis is a complex condition that results from a combination of genetic predisposition, environmental triggers, and an overactive immune system. By understanding these factors, we can better manage and treat this chronic skin condition. Now let's move on to our next topic, the different types of psoriasis and their distinct characteristics and symptoms. Alright, now that we have discussed the causes and risk factors of psoriasis, let's dive into the various types of this skin condition. There are 5 main types of psoriasis: plaque psoriasis, guttate psoriasis, inverse psoriasis, pustular psoriasis, and erythrodermic psoriasis. Each type has its own distinct characteristics and symptoms. So, let's go through them, one by one. First up is plaque psoriasis, the most common type, affecting around 80 to 90% of people with psoriasis. Plaque psoriasis is characterized by red, raised, and scaly patches of skin, often covered with a silvery white layer of dead skin cells. These patches can appear anywhere on the body, but they are most commonly found on the elbows, knees, scalp, and lower back. Next, we have guttate psoriasis, which is the second most common type. This form of psoriasis is characterized by small, red spots that resemble teardrops. Guttate psoriasis often appears suddenly and is typically triggered by a bacterial infection, such as strep throat. It is more common in children and young adults. Inverse psoriasis, also known as intertriginous psoriasis, affects the skin folds and creases of the body, such as under the breasts, in the armpits, and around the genitals. This type of psoriasis appears as smooth, red, and shiny patches of skin, without the characteristic scales seen in plaque psoriasis. Inverse psoriasis can be particularly uncomfortable due to its location in sensitive areas and the increased risk of irritation from friction and sweating. Pustular psoriasis is a less common form, characterized by the presence of pus-filled blisters or pustules on the skin. These blisters can be localized to certain areas, like the hands and feet, or more widespread across the body. Pustular psoriasis can be a severe and sometimes life-threatening condition, requiring immediate medical attention. Lastly, we have erythrodermic psoriasis, which is the rarest and most severe form of the condition. It is characterized by widespread redness, inflammation, and scaling of the skin, often covering the majority of the body's surface. Erythrodermic psoriasis can be life-threatening due to the increased risk of infection and the body's inability to regulate temperature properly. In summary, there are 5 main types of psoriasis, each with its own distinct characteristics and symptoms. First, understanding these differences is crucial for proper diagnosis and treatment. Now let's move on to our next topic, the potential physical and psychological impacts of psoriasis on individuals' quality of life. Now that we've discussed the causes and types of psoriasis, let's delve into the potential physical and psychological impacts this skin condition can have on an individual's quality of life. Psoriasis is more than just a skin issue. It can significantly affect a person's overall well-being, with social stigma, depression, and comorbidities being some of the major concerns. One of the primary challenges faced by people with psoriasis is the social stigma associated with the condition, where visible skin lesions can lead to feelings of embarrassment, self-consciousness, and even discrimination from others who may not fully understand the nature of the disease. This can result in social isolation, difficulties in forming and maintaining relationships, and a negative impact on one's professional life. Depression is another significant concern for individuals with psoriasis. The chronic nature of the condition, coupled with the social stigma, can take a toll on mental health. Studies have shown that people with psoriasis are more likely to experience depression and anxiety compared to the general population. Additionally, stress and depression can worsen psoriasis symptoms, creating a vicious cycle that makes managing the condition even more challenging. Psoriasis is also associated with several comorbidities or coexisting medical conditions. One such comorbidity is psoriatic arthritis, which affects around 30% of people with psoriasis. Psoriatic arthritis is an inflammatory joint condition, causing pain, stiffness, and swelling in the affected joints. If left untreated, it can lead to permanent joint damage and disability. Another comorbidity is an increased risk of cardiovascular diseases, such as heart attacks and strokes. Research suggests that the chronic inflammation associated with psoriasis may contribute to the development of these conditions. It is essential for individuals with psoriasis to monitor their heart health and work closely with their healthcare providers to manage these risks. In conclusion, psoriasis has a significant impact on an individual's quality of life, affecting both physical and psychological well-being. Addressing these challenges is crucial for improving the overall health and happiness of people living with this condition. As we move on to our next topic, we will discuss the different treatment options available for managing psoriasis and their potential side effects and efficacy. Now that we've explored the physical and psychological impacts of psoriasis, let's discuss the various treatment options available for managing this chronic skin condition. It's important to note that there is currently no cure for psoriasis. However, treatments can help control symptoms and improve the quality of life for those affected. The main treatment options include topical therapies, light therapy, systemic medications, and biologic agents. Let's go through each of these in detail. Topical therapies are the first line of treatment for mild to moderate psoriasis. These involve applying creams, ointments, or gels directly to the affected skin area. Some common topical treatments include corticosteroids, vitamin D analogs, and coal tar preparations. These medications can help reduce inflammation, slow down the growth of skin cells, and alleviate itching. However, potential side effects may include skin irritation, thinning of the skin, and uneven skin tone. Light therapy, also known as phototherapy, uses controlled exposure to ultraviolet light to help manage psoriasis symptoms. This can be done using natural sunlight or specialized equipment that emits UV light. Light therapy can be effective in reducing inflammation and slowing down the growth of skin cells. However, it may also increase the risk of sunburn, skin aging, and skin cancer. So it's essential to follow your healthcare provider's recommendations for safe and effective use. Systemic medications are oral or injectable drugs that work throughout the entire body. These are typically prescribed for moderate to severe psoriasis or when other treatments have failed to provide relief. Some examples of systemic medications include methotrexate, cyclosporine, and retinoids. While these drugs can be effective, they may also have potential side effects such as liver toxicity, kidney problems, and an increased risk of infections. Biologic agents are a newer class of medications that target specific parts of the immune system involved in the development of psoriasis. These drugs, such as adalimumab, etanercept, and ustekinumab, are typically administered via injection and are used to treat moderate to severe cases. Biologic agents have shown promising results in managing psoriasis symptoms, but they can also have potential side effects, including an increased risk of infections and the development of certain cancers. In summary, there are several treatment options available for managing psoriasis, each with its own potential side effects and efficacy. It's crucial to work closely with your healthcare provider to find the most suitable treatment plan, tailored to your specific needs and condition severity. As we move on to our final topic, let's discuss the importance of adopting a holistic approach to psoriasis management. As we wrap up our discussion on psoriasis, it's essential to recognize the importance of adopting a holistic approach to psoriasis management. This means looking beyond medical treatments and focusing on various aspects of your life that can help you cope with this lifelong condition. Some key components of a holistic approach include stress reduction, maintaining a healthy lifestyle, and establishing a strong support system. Stress reduction is vital in managing psoriasis, as stress can trigger or worsen symptoms. Incorporating relaxation techniques such as deep breathing, meditation, or yoga into your daily routine can help keep stress levels in check. Additionally, engaging in hobbies or activities that bring you joy and relaxation can also contribute to better stress management. Maintaining a healthy lifestyle is another important aspect of psoriasis management. This includes eating a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Staying physically active through regular exercise can help improve your overall well-being and potentially reduce inflammation. It's also crucial to get adequate sleep and avoid smoking and excessive alcohol consumption, as these factors can negatively impact your condition. Finally, establishing a strong support system is vital when coping with psoriasis. This can include family, friends, healthcare professionals, or even support groups specifically for people living with psoriasis. Connecting with others who understand your experiences can provide valuable emotional support, practical advice, and a sense of belonging. In conclusion, managing psoriasis requires a comprehensive and holistic approach that goes beyond medical treatments. By focusing on stress reduction, maintaining a healthy lifestyle, and building a strong support system, you can better cope with this lifelong condition and improve your overall quality of life. Remember, you're not alone in your journey. And with the right tools and resources, living well with psoriasis is possible.